Every single day, Americans die from preventable deaths. Save with CPR is looking to change that. You are about to receive life-saving education from Save with CPR, so please make sure to give us your full attention because during an emergency is not the time to be helpless. My name is Drew Toma, founder of Save with CPR, career paramedic, and educator. I have the honor of being invited into people's lives on their worst days to make things better. With that honor, I've had to tell countless families that their loved one has passed away. Many times it was unpreventable, but sometimes it was preventable. I think about those people and their changed lives quite a bit. If I had just 30 minutes with the families, friends, or coworkers there that day, I could have given them the tools and the training to prevent their loved one's death. And so it's my mission, my life's goal, to help educate and empower as many people as possible, so your loved one has the best chance of survival. Now please join me as I show you how to save with CPR. I think I just recognized an emergency, which is the first step to recognize an emergency. You have to be open to obvious as well as ambiguous signs, such as loud noises, a person not moving, someone who appears to be confused, bleeding, or even contents leaking out of vehicles or containers. If you suspect an emergency, don't immediately move towards it, but instead call 911 from any phone within the United States. They will first need to know your location of where you are, then they'll ask details about the situation. Also, never be afraid of calling 911. Even if it isn't an emergency, nothing bad will happen. It's better to call and not need it than to not call 911 in an emergency. If you call 911 by mistake, that's okay. Stay on the line, talk to the call taker, let them know that this was a mistake. Otherwise, they'll have to spend resources trying to find you. So now that we've recognized an emergency and help is on the way, should we jump in and help? Well, not so fast. You can't render aid if you become a victim yourself. So never enter a scene that is potentially unsafe. If you see multiple people not moving, it's not safe. If you hear gunshots or other ominous sounds, think about those horror movies and the characters that go to investigate. No thank you. If you see fluid leaking from a vehicle or a container, or if you see downed telephone poles, do not approach. They may be energized, the contents that are leaking could be hazardous. So again, call 911, activate first responders, and help other people not approach or enter this unsafe scene. Also, if you're in or around the road, understand that many first responders and tow truck operators die every single year from bad drivers and accidents. So stay away from the roadway if you're able to, especially with vehicles whizzing by. If you're ever stranded on the side of the road, get yourself as far away from that road as possible, including the other side of the guardrail. I can't list everything, so use your common sense and don't run into a situation where you may become a statistic. I think I see someone in a safe area that I can help. Hello, I'm Drew and I'm Save with CPR trained. It looks like you need some help. Do you mind if I help you? Now notice how I introduced myself as a trained responder and asked the person for permission to help. That's called expressed consent. Just because someone is injured doesn't mean they lose the ability to make their own decisions. With express consent, the person has chosen to accept our offer for help. On the other hand, if a person's unconscious, we get implied consent, as it's implied that the unresponsive person would want to be saved, would want our help. It's also important that you're not afraid of providing help. All 50 states have Good Samaritan laws, which protect you from legal liability as long as you act within your scope of training and you're being reasonable. Each state's different, so I suggest you research your state's Good Samaritan laws. But keep in mind, these laws do not protect you from injury or disease. That's why it's important to utilize personal protective equipment, or PPE. When dealing with bodily fluids, it's important to recognize that we may be exposing ourselves to disease, which we probably don't want. So what can we do to stay safe? Well, make sure to put gloves on before touching anything. We have a saying in EMS, if it's warm, wet, and sticky and not yours, don't touch it. So make sure you properly remove your gloves when done, and do not touch your face until you've washed your hands with warm running water and soap for at least 20 seconds. The last thing I'll bring up before we move on is being kind to and helping yourself. Seeing, responding to, and being involved in emergencies, injury, and death are big life events. These events can consume us and our lives in a negative way, especially if our rescue efforts are unsuccessful. I want you to know that despite your best efforts, you're not guaranteed to be successful. You did everything you could because you care, and I commend you for that. It's important to talk to a mental health professional after something like this, as they can help you work through these difficult life events, complex feelings, and most importantly, give you your life back. The last thing anyone wants is more loss. Thank you, and I look forward to seeing you for the rest of your Save with CPR training. Welcome to Save with CPR's First Aid Training. In this video, we will cover principles of first aid, calling 911, medical emergencies, and traumatic emergencies. First aid is the initial care provided to a person suffering from a sudden illness or injury with the primary goal of preserving life, preventing the condition from worsening, and promoting recovery. First aid is typically administered by a layperson until professional medical assistance becomes available. The principles of first aid include remaining calm, assessing the situation, protecting oneself and the victim from further harm, and providing appropriate care for injuries or conditions. Knowledge of first aid is invaluable as it equips the individuals with the skills to respond effectively in emergencies, potentially saving lives and reducing the severity of an emergency situation. Calling 911 is a critical step in any emergency situation as it connects you with the professional medical responders who can provide life-saving assistance. When you dial 911, stay calm and speak clearly. Provide the dispatcher with your exact location, including any landmarks or cross streets that can help emergency services find you quickly. Describe the nature of the emergency and any specific conditions of the patient, such as unconsciousness, severe bleeding, or difficulty breathing. Follow the dispatcher's instructions carefully, as they can offer vital guidance when help is on the way. Remember, timely communication with 911 can significantly improve the chances of a positive outcome in an emergency. Remember, these first aid steps are intended to provide immediate assistance until professional medical help arrives. Always prioritize safety and seek medical attention when necessary. A medical emergency is a sudden and unforeseen situation that poses an immediate threat to an individual's health, well-being, or life. These emergencies require urgent intervention to prevent serious harm or death. Examples of medical emergencies include cardiac arrest, severe bleeding, strokes, choking incidents, and severe allergic reactions called anaphylaxis. The hallmark of a medical emergency is its acute nature, demanding quick and decisive action to stabilize the patient, provide essential care, and ensure they receive appropriate medical treatment as soon as possible. Prompt recognition and response are crucial in mitigating the potential long-term consequences and improving the chances of survival and recovery. An allergic reaction is the body's immune system response to a substance that it perceives as harmful, even though it may not be harmful to others. When an individual with allergies comes into contact with an allergen, such as foods, medications, insects, pollen, or animal dander, their immune system reacts by releasing chemicals such as histamine. These chemicals trigger allergic reaction symptoms, which can range from mild to severe and may affect the skin, respiratory system, gastrointestinal tract, and cardiovascular system. Symptoms of an allergic reaction may include hives, itching, swelling, especially around the face, lips, and the tongue or the throat, difficulty breathing, wheezing, nausea, vomiting, or dizziness. The reaction may be triggered by foods, medications, insect stings, or other allergens. So check if the victim has any known allergies, check if the victim has an epinephrine autoinjector, and check if the victim may have been exposed to an allergen. If you suspect the person is having an allergic reaction, you should do the following things. If the person has an epinephrine autoinjector and 2 or more signs of an allergic reaction, help them use it immediately according to the instructions provided. Call 911 to start first responders. Then stay with them and provide reassurance until help arrives, and to update 911 if anything changes. Pictured is the EpiPen. That's a brand name of one of the epinephrine autoinjectors. The way this device works is you slide it out of the case, you take the blue cap off of the end. You need to make sure that you hold the EpiPen with a closed fist so you don't accidentally leave your thumb over the needle and inject yourself. You'll then take the epinephrine autoinjector, you'll push it hard against the victim's leg as pictured here for at least 3 seconds. After the 3 seconds, you may remove the epinephrine autoinjector, having given a dose of epinephrine. Also keep in mind, they have adult epinephrine pens and they have pediatric epinephrine pens. So make sure you have the right one and it's prescribed to the victim. Diabetes is a complex medical condition that can lead to situations where the victim has too much glucose or sugar in their blood or not enough glucose or sugar in their blood, both with their own set of problems. So recognizing a diabetic emergency is fairly important. One of the biggest signs of a diabetic emergency is going to be altered mental status. You may view that as confusion, lethargy, or the person is unresponsive wholly. Symptoms of low blood sugar, which is called hypoglycemia, may include weakness, confusion, sweating, trembling, rapid heart rate, or loss of consciousness. Symptoms of high blood sugar, called hyperglycemia, may include excessive thirst, frequent urination, weakness, nausea, or confusion. In recognizing diabetic emergency, the two most important things to consider are: does the victim have a history of diabetes? And what is their blood sugar? So, what are the first aid steps for a diabetic patient? If the person is conscious and experiencing symptoms of low blood sugar, suggest that they check their sugar levels. If their blood sugar is low and they are able to swallow, give them a fast acting carbohydrate, such as fruit juice, candy, or glucose tablets. If the person is unconscious or unable to swallow, do not give them anything by mouth. Call 911 and stay with the victim. Difficulty breathing is where somebody is having a hard time catching their breath, getting full breaths, and ultimately potentially getting oxygen. Symptoms may include shortness of breath, wheezing, coughing, chest tightness, or bluish discoloration of the lips or fingernails. Difficulty breathing may be caused by asthma, allergies, respiratory infections, or other medical conditions. When identifying difficulty breathing, it's very subjective, so the ultimate person who's going to report being short of breath is the victim. If a person is experiencing difficulty breathing, there's a few things you can do to assist them. Help the person sit upright and lean forward to assist with their breathing. If the person has a prescribed inhaler or respiratory medication, assist them in using it according to the instructions provided. If the person's condition worsens or they show signs of severe respiratory distress, such as an inability to speak, gasping for air, call for emergency services immediately. Fainting is also known as syncope. It's a temporary loss of consciousness, typically caused by a temporary decrease in blood flow to the brain. Symptoms may include dizziness, lightheadedness, nausea, sweating, or pale skin. If a person feels faint or has fainted, encourage them to lie down, loosen tight clothing. If the person faints, check for responsiveness and breathing. If they are not breathing, start CPR. But either way, call 911 immediately. Heart attacks are caused by abnormal blood supply to the heart. Symptoms may include chest pain or discomfort, pressure, squeezing, fullness or pain on or around the chest, pain or discomfort in other areas of the upper body, such as the arms, back, neck, jaw, or even the stomach. Shortness of breath, nausea, or lightheadedness. Keep in mind, women and older adults may experience atypical symptoms such as fatigue, weakness, or indigestion. If the patient is not allergic, encourage them to take 324 milligrams of aspirin by chewing it. This would be 4 81 milligram baby aspirin. If the person is prescribed nitroglycerin and their symptoms persist, suggest they consider taking it as prescribed. Seizures are caused by disorganized electrical activity in the brain. These seizures can manifest as convulsions, muscle stiffness, loss of consciousness, staring spells, or involuntary movements. Seizures may be caused by epilepsy, fevers, head injury, strokes, or other medical conditions. If you find a person suffering from a seizure, keep the person safe from injury by moving objects out of their way and cushioning their head with a soft object. Do not restrain the person or put anything in their mouth. After the seizure ends, help the person into a safe position and provide reassurance. Don't forget to call 911 for this person. A stroke is caused by inadequate supply of blood to the brain, either from a blood clot or a bleed. Strokes can happen to anyone at any age. The signs of a stroke would consist of numbness or weakness to the face, especially one side of the face. If you have them smile and show their teeth and one side of the face droops down or doesn't have the same strength, that could also be a sign. Confusion or trouble speaking or difficulty understanding speech is another possible sign of a stroke. Trouble seeing with one or both eyes, changes in vision, double vision. Difficulty walking, being dizzy, imbalances could also be a sign of a stroke. Also, a severe headache could be a sign of a stroke. What's called a thunderclap headache with a strong and immediate onset, sometimes described as a thunderstorm in your head. If any of these signs or symptoms present, call 911 immediately. stay with the person, and be with them until help arrives. A traumatic emergency is a type of crisis that results from sudden, severe physical injury or impact to the body. These emergencies can arise from various incidents such as car accidents, falls, sports injuries, or violent acts. Traumatic emergencies often involve damage to bones, organs, tissues, and may result in conditions like fractures, spinal injuries, head trauma, or severe bleeding. The nature of these injuries often require immediate and specialized medical attention to prevent complications, reduce pain, and promote healing. Prompt and appropriate first aid response, such as controlling bleeding, stabilizing fractures, and preventing shock, is essential in managing traumatic emergencies and ensuring the best possible outcomes of the affected individuals. Bleeding is the loss of blood. Bleeding can occur externally from a wound or internally from damaged blood vessels. Signs of external bleeding may include blood flowing from a wound, soaking through clothing or bandaging, or pooling on the ground. Signs of internal bleeding may include swelling, bruising, pain, or tenderness in the affected area, along with signs of shock, pale skin, rapid heart rate, or rapid breathing. The first aid steps for bleeding are fairly straightforward. First, apply direct pressure to the wound using a clean cloth or sterile dressing to control bleeding, or your gloved hand. If bleeding persists, apply a tourniquet above the wound as you'll see in the next video. Call 911 and stay with the patient until help arrives. Symptoms of a broken bone, called a fracture, may include pain, swelling, bruising, deformity, and difficulty moving the affected limb, or a grating sensation at the injury site. Open fractures occur when the broken bone protrudes through the skin, while closed fractures do not break through the skin. If you suspect somebody is suffering from a broken bone, immobilize the injured limb to prevent further movement and minimize pain. Apply ice packs or cold compresses to reduce swelling and alleviate pain. Seek medical attention promptly for evaluation and treatment of the fracture. Call 911 to have the victim transported to the nearest hospital for treatment. Burns can result from exposure to heat, chemicals, electricity, or radiation. Burns are classified into three categories: first degree burns, which are superficial; second degree burns are partial thickness; and third degree burns, full thickness. Symptoms of burns may include redness, swelling, pain, blistering, charred skin, or difficulty breathing in the case of inhalation burns. If you suspect somebody has suffered a burn, remove the person from the source of the burning and cool the affected area with cool running water to stop thermal burning only if the area is still actively burning. Then, remove any clothing or jewelry from the burned area unless it is stuck to the skin. Cover the burn with a clean, dry, sterile dressing to protect it from infection, and seek medical attention for severe burns, especially burns involving the face, hands, feet, or genitals, or burns larger than the size of a palm. Call 911 to activate EMS for a medical evaluation. Thank you for learning about first aid with us. This video serves as a general foundation with some good general principles to approach medical and traumatic emergencies. While we're unable to cover everything in these videos, we hope it serves as a good starting point. Your instructor may take some time after this video to review some of these techniques or different situations outside of this video.